One of the things that I like to talk about with my patients in a breast augmentation consultation, and this is a very important topic, are the two different types of breast implants. You have saline and you have silicone. And they're two wildly different technologies, but they both have their pluses and minuses and their benefits. So on one hand, you have saline breast implants, which is essentially a bag full of a sterile water solution. One advantage of a saline breast implant is that they don't come pre-filled. We inflate them and fill them with saline once they're placed in the patient during the surgery. So we're able to make a very tiny, small incision to place that deflated implant and make our pocket with our dissection, place the implant, and then inflate it once it's already placed in the patient. Another added benefit of a saline breast implant is that if it were to rupture, if it were to deflate, it is very noticeable. It is essentially just a ruptured shell of saline, and your body absorbs that sterile saline solution, and it is very physically noticeable if you have a ruptured implant, because that needs to be removed and possibly replaced, and that is something that your plastic surgeon needs to be aware of. One of the drawbacks of a saline breast implant is some patients do subjectively say that it does not feel as natural as a natural breast. It does have more risk or the ability to be more prone to rippling or shape deformities in compared to a silicone breast implant. But however, it is still a nice, well understood technology, and some patients still do choose a saline breast implant. Now for a silicone breast implant, those come pre-filled. Okay, so the surgical incision for placing a silicone breast implant needs to be a little bit wider because you have to fit the implant in during the surgery. One of the added benefits of silicone breast implant is patients do say that compared to a saline breast implant, it does feel like a more natural breast tissue. Physically, it is better disguised. Visually, it is easier to disguise. Subjectively, a silicone breast implant. One of the drawbacks of a silicone breast implant, however, is in comparison to a saline implant, if you were to have a failed implant with a rupture that is silicone, sometimes it's not as visibly noticeable, sometimes not as physically noticeable, and you can have a silent rupture. And that can lead to complications with the breast implant capsule and the breast implant itself, and it leads to a more difficult removal and revision surgery. So those are just things that I like to discuss with my patients when talking about breast implants and breast augmentations, is what they're going for, what shape they're looking for, how high maintenance or low maintenance of an implant they're looking for. Do they have enough breast tissue to disguise an implant? Do they have the ability to shape or disguise the upper pole of the implant, what kind of pocket we need to form, things of that nature. So these are very important things that you need to discuss and bring up if your plastic surgeon does not. But that is essentially the basics of the two different types of breast implants.